Hello, I'm Dr. Jimmy Hang. I am a clinical orthopedic physical therapist specialized in sports medicine, and I'm here to talk to you about what makes up the IT band and what exercises you could do to help relieve the symptom after a long run or training for a marathon. And the iliotibial band, or the IT band for short, is one of the most common injuries for runners. The IT band is actually made of a tendon sheath, and it doesn't really stretch. You could decrease some of the tension, but it doesn't necessarily stretch because it's really tight. So what makes up the IT band is two muscles. One is the TFL, short for tensor fascia lata muscle, and the other muscle is the gluteus maximus muscle. Between these two muscles, the TFL and the gluteus maximus converges into a tendon which we refer to the IT band, inserts into your femur lateral epicondyle, and it fans out into a tendon sheath into the lateral part of your kneecap, your patella, and the distal or the bottom end inserts to the tibia tubercle. So it's like almost like this type of shape, like a fan shape. So the reason why people have IT band syndrome, we call it, is due to overcompensation of your TFL muscle because it acts as an internal rotation of your pelvis or your hip. And this is because due to the lack of strength or the weakness of the gluteus maximus, gluteus medius, gemellus, all those external rotators of your pelvic, and also some of the overcompensation of your hamstrings and some weakness of the hamstring as well too. So during running, when someone runs during the swing phase, as they pick up their knee, typically through the flexion of the knee, what happens is your femur supposedly external rotates and your tibia internal rotates. And because of this overcompensation, it causes tension in this IT band because when it tenses, the TFL fires and it rotates inwards. And due to that rotation and counter force of the femur that's supposed to rotate out, this causes it rotate in, it causes increased tension of the IT band. So it causes rubbing every time you flex the knee, like so. Okay? Now if you strengthen the hamstrings, release some of the tension in the TFL. I'm sorry, not only hamstrings, but the gluteus maximus, medius, all the external rotators. Then it helps to stabilize the pelvic girdle and your muscles much more readily, so it has less tendency to rotate the hip inwards and causing tension in the IT band, so it doesn't rub as freely over the lateral epicondyle of your femur. So with that said, I hope you understand some of the reason behind the IT band syndrome, and it's due to muscle imbalance, overcompensation issues, and that's something that us physical therapists could help you with. And the next clip of exercises that will help relieve some of the tension you have in your TFL and some of the neuromuscular type of exercise that you could help with your joint in your knee as well. Thank you for watching. I hope you subscribe to our channel.